Medical coverage now is Southern New England and actually the entire nation facing an opioid crisis. Joining us now to talk more about it is Dr. Jody from Miriam Hospital. Good morning. Thanks for coming in this morning.
Good morning, Patrick.
Good to have you here. Tell us about what you've seen personally when it comes to this crisis, which really has sort of exploded over the last, 3 to 5 years, it seems.
Absolutely. There's not one of us in Rhode Island who's not going to be impacted personally by this, either by a friend, family member, or a colleague's loved one who dies from this overdose deaths. This is a tragic situation.
Why do you think it's picked up so much in intensity over the last couple of years?
So this has its roots in pain management by the medical community, and we as physicians were led down a garden path to use more opiates to treat pain, which previously we were doing poorly. Unfortunately, we did not recognize the consequences that we're in right now. We flooded the market with prescription opiates. People get hooked on prescription opiates. Then when they can no longer afford them or get them, they transition to heroin. That supply is now contaminated with fentanyl, which is much more dangerous, and people are dying.
So what has to be done? I know is the train too far down the tracks here to stop it, or do you see signs of being able to reverse this trend?
So the governor has an excellent plan, overdose prevention plan. It can be found on strategicplanri.org, and really addresses the key issues, the key driving factors. The first and most important thing is treatment. We have excellent treatment for this disease. Physicians can prescribe it. They need to step up to the plate and start prescribing it. And we need to get rid of the stigma around this disease. This is a disease. We've been treating this disease as a crime and spending a lot of resources locking people up, right, gumming up the courts, and we really need to treat it as a disease.
So the message has to be to people that, how do you say, well, you won't get in trouble if you seek treatment? Because I know a lot of folks are probably saying, I don't want to ask for help because then I'm going to end up in jail.
This disease consumes your life. It takes over your life. It destroys your family, your work, your home, housing. It really takes over your entire life. And people need to understand that and recognize that treatment works, that treatment's highly effective, that this disease could happen to virtually any of us and any of our families, and that we need to have compassion and understanding and treat people, because using the criminal justice system has failed. People get in and out and ultimately don't get their disease treated. But medication treatment does work.
We have about 30 seconds. What is being done at Miriam Hospital to help folks that have this awful addiction?
So the Miriam Hospital and the entire state really need to step up to the plate and start treating this. We have patients coming into the criminal justice system and coming into the medical system, and we need to identify them and connect them to treatment. So we need to expand our treatment capacity statewide and get those people treated. If we do that, I think we'll show a dramatic decrease in overdose deaths as been shown elsewhere.
All right, Doctor, thanks so much for coming in this
Thank
morning.
you.
And for much more on this topic, you can also see this interview again in its entirety. Just go to WPRI.com.